Welcome to our Public Health Conversation Starter. This is a series of discussions we are having with thinkers who provide a critical perspective on the work of public health. Today, I have the great privilege of speaking with someone who really needs no introduction. Professor Noam Chomsky's Wikipedia page describes him as, quote, a linguist, philosopher, cognitive scientist, historian, social critic, and political activist. But even this does not quite do justice to the depth of his influence across multiple fields. He has been called the father of modern linguistics, and his political writing was foundationally formative for many, myself included. Where there are conversations happening about shaping a better, more just world, Professor Chomsky is always there, a voice to be reckoned with. I am delighted that he is here with us today. Welcome, Professor Chomsky. Thank you for joining us.
Pleased to be with you.
So, Professor Chomsky, can you remember your earliest political thoughts? What were some of the ideas and issues that first shaped your trajectory as a public intellectual?
Goes back 90 years to the Depression. I grew up in the Depression. My earliest memories are miserable people coming to the door, trying to sell rags, riding with my mother in a trolley car past a factory where women strikers were in the picket line and being attacked by security forces. My own family, extended family, was first-generation immigrants, working people, mostly unemployed in those days, union members, politically very active. It's quite a different time from today. My parents happened to have jobs, which was unusual. They were Hebrew teachers, so not a huge salary, but enough to live on. So a lot of the family just congregated around them. Like my cousins would come during the summer and stay with us and that sort of thing. One uncle of mine was disabled and was able, under New Deal programs, to get a newsstand. So he was a very interesting person, had a huge influence on my life. He never went past fourth grade, but he was one of the most educated people I've ever seen come across. And I spent a lot of time, my cousins also spent a lot of time at the newsstand, just working there, handing out papers and talking to him and talking to other people who congregated around. There were a lot of emigres in those days. This is the 30s. And there were emigres from Germany, a lot of them psychiatrists and psychoanalysts, which my uncle was interested in. And they had lively discussions about the latest opinions of Freud and Steckel and other figures. And he was also politically very active. He'd been through every imaginable left sect and knew all about them. I was quite interested in this. When I got a little bit older, around 12 years old, I lived in Philadelphia. My parents would allow me to take the train by myself to New York, where he was, and most of the family was, and I would stay with my uncle and his wife and hang around. New York looked very different in those days. I'd hang around Union Square, which was then a center for lots of left offices, Freie Arbeiterstimme. Down Fourth Avenue, there were secondhand bookstores, a lot of them run by recent emigres, some from people who fled from Spain after Franco took over. Among them were anarchists from Spain who had a lot of materials on anarchist literature, which I picked up. They were both there and at the Freie Arbeiterstimme office. They were very happy to talk to some young kid who was interested in these things. So picked up quite a radical education just by talk and osmosis and things. But by then it was pretty well said.
Well, let me jump ahead. I want to jump ahead now to the COVID pandemic, if I may. And I want to ask you about public health, about your sense about public health during the pandemic. What did public health do right, and what did public health do wrong?
What public health did wrong primarily was not having a universal healthcare system. You probably just saw the paper that came out, I think, in the proceedings of the National Academy of Sciences that estimated that I think they said about close to 400,000 deaths a year were simply caused by not having public health available, as in most other countries. And I think they estimated about $500 billion of extra expenses. There actually was a paper in The Lancet a couple of months, maybe a year ago, which had similar estimates. So the huge mistake is not having public health available, having a privatized system, which is highly inefficient, extremely expensive. I mean, as you know better than I do, the United States does have universal health care. It's called emergency rooms. So if you're really in trouble, or even if you just have a cold and you can't get to see a doctor and you don't have insurance, you can go to the local ER. It's difficult. You may hang around for a long time because they have triage, but you do get good care at enormous expense and extreme savagery. It's an incredible system. I mean, I don't have to get you the details. You know them all very well. It's roughly twice the expenses of comparable countries and much worse outcomes, and a very savage treatment. It's getting much worse now as the prices of drugs are skyrocketing and the government is no longer providing, subsidizing them. Lots of the drugs, COVID and other drugs, are just out of sight for people. Meanwhile, the pharmaceutical corporations are bulging with profits thanks to the globalization, so-called free trade agreements, which are in fact investor rights agreements, which have exorbitant patent rights of a kind that never existed before. One good economist, Dean Baker, has tried to estimate the costs to the economy and to people from the exorbitant patent regime. It comes to, excuse me a second, okay. It comes to huge amounts of money that are lost or handed over to pharmaceutical corporations for things they didn't do. Government subsidized research, which they then patent and allow them to set extraordinary prices way above the level that they require. And this is going to have a major impact on the future. I mean, everyone in the public health field knows that it's very likely that other pandemics are coming, and they could be much more severe than this one. It is known how to prepare for them, but the preparations aren't being made. That requires, the pharmaceutical corporations aren't going to do it. They're there to make money, not to protect people a generation from now. It requires large-scale government programs, which will prepare the ground for future pandemics that are unpredictable, but that are very likely to come along. That includes everything from spare capacity in hospitals, none of this just-on-time business model, which is maybe okay for building cars, but doesn't work for public health. So everything from that to serious vaccine research, which will prepare the ground for the future, but it's not being done because we're geared to an economy which is designed for short-term profit for the rich and the corporate sector. That's the kind of economy you have. Too bad. You're just facing disaster. Right now, it's a bad problem, but could be really disastrous in the future.
Let me ask about something you've written quite a bit about, which is power. I want to ask about power for a second. And I want to ask about power in the context of public health, if I may. You know, during the pandemic, public health found itself in a position of power. And I think sometimes public health used it well, sometimes less so. I guess I'm curious about your reflections on power and public health, the potential and the pitfalls, and how public health can use its power effectively and ethically.
Well, my general impression is that the public sector performed reasonably well in very difficult circumstances. I mean, it was not clear at the beginning just what the infection was, whether it was how it was transmitted. There were contradictory proposals, most of them, I think, attributable to lack of information and understanding. In retrospect, you can certainly think of things that could have been done better, but overall, the public sector seemed to me to perform moderately well under the extremely difficult conditions that it faces, namely those that I described. The fact that we really don't have a functioning public health system. Hospitals make a lot of profit, but doctors are, there was a recent article you surely saw in the New York Times about how doctors are simply leaving the profession because they can't do their job. The circumstances are such that they're committed to trying to help patients, but the system is designed for profit, not care. So they're disillusioned, overworked. Nurses are hopelessly overworked. Anyone who's ever been in, I've been in over the years, have had spent time in hospitals, good hospitals, the best ones in Boston. The nurses are overwhelmed. They can't possibly do their jobs. They're frustrated. I could give you personal experiences from some of the top hospitals, but again, I'm sure you know more about this than I do. And they're underpaid, overworked. There aren't enough of them. Doctors are disillusioned. The whole system is well-designed wreckage to make profit, but not to care for people.
Let me ask you about something else you've written a lot about, which is sort of free speech. And you know, during the pandemic, we know that many people said all sorts of things that were untrue and that were unproven, particularly around, for example, vaccines. And this arguably put lives in danger. I'm just curious about your thoughts about how we as a society maintain our commitment to free speech while also dealing with the spread of misinformation that has been so facilitated by new technology.
Well, as I think we ought to maintain the commitment to freedom of speech. That's very important. That means that there will be lots of disinformation circulated. It has led to a huge number of deaths, overwhelming hospitals with unvaccinated patients so that they can't perform ordinary procedures. I've run into that myself, incidentally, and but you can't stop it by stopping speech. What you have to do is look into the roots. Why is this happening? Why are people so disaffected? And why is society collapsing to such an extent that you have anti-vaccine movements developing? Well, you look back to the source, it's not too hard to find. It's not just anti-vaccine movements. Across the board, people have lost faith in institutions. You look at polls on the whole range of institutions, Congress, president, corporations, across the board, people just don't trust them. There's been a sharp decline in trust, and in even trust in other people, mutual aid and so on. It's not hard to find the source. We've lived through 40 years of a major assault on the social order. It's given the name neoliberalism, but if you look into it in detail, it's really a kind of class war, which has broken up the social order, atomized people, taken away services that they expect from government. The government's not doing anything for them. It's in fact harming them. Other institutions are harming them. So people are angry, disaffected, resentful, easy prey for demagogues, Trump-style demagogues, Bolsonaro in Brazil, others, AFD in Germany, and so on. It's worldwide, most strikingly in places like the United States, and Britain, which have been in the forefront of this. And it doesn't come as a big surprise. Go back to 1980, Reagan and Thatcher. Thatcher was who initiated this program. They were quite outspoken. Thatcher's famous comment, which you've seen, I'm sure, was that there is no society, just individuals out on the market trying to protect themselves somehow. Of course, she knew perfectly well that this was a complete lie. For the rich and powerful, there's a very extensive, highly developed society, trade associations, chambers of commerce, business roundtable, the government, which they largely control, which steps in to bail them out if they get into trouble. But for the rest of us, not the rich and the corporate sector, not supposed to be any society. Her example was a homeless person. Said if someone's homeless, he shouldn't be whining about it. He shouldn't be asking for society to protect him. He should go out and get a job and work. Easy for her to say. It's not the way life works. What about working people? She wasn't silent about that. Her major initiative, first one, was to destroy the labor unions, and she explained why. Her words were, workers are idle, ignorant, inferior, and disruptive. So they have to be brought back under control. Reagan did the same thing. First acts, destroy the unions by illegal measures, opening the door for the corporate sector to carry forward the destruction of unions, which are the major way in which ordinary people can protect and defend themselves. That's the Republican program for the last 40 years. Right now, this minute, yesterday's speech on Biden's State of the Union speech, what was the Republican response? He's trying to grow government. He's trying to increase taxes on the rich and the corporate sector. Can't have any of that. First act of the new House was to undermine the efforts to allow the Internal Revenue Service to function. Can't allow the IRS to function. It goes after tax cheats. Who are the tax cheats? Not some working class guy. The tax cheats are the rich and the corporate sector. Can't go after them. We have to serve them. We're their slaves. That's the Republican Party. What's the Democrats? By the 1970s, the Democrats had pretty much given up any commitment to the working people. It was clear under Carter. Later years became more clear. They simply became a party of affluent professionals, people like you and me. We vote Democratic. That's their constituency. Not working people, not offering them anything. So what do? They vote for Trump. At least Trump says, I love you, while he's stabbing them in the back. Democrats don't even do that, just stab them in the back. So yes, you get this breakdown of the social order. People are easily open to demagogues, to cults. Somebody can say, I can save you. One aspect of that is anti-vax movement. Why should we trust these people who are sticking things in our arms? We don't trust them on anything else. So I think it's a symptom, a very dangerous symptom, but it's a symptom of something that's rotten at the core. And we have to go back to that. It's usually not, I mean, if you look at simply things like real wages or the minimum wage, through the 50s and the 60s and into the 70s, they pretty much tracked productivity. Then it breaks. From around 1980 on, real wages stagnate. For non-supervisory workers, they actually decline. Benefits decline. Minimum wage stagnates, which means it declines in real terms. Meanwhile, corporate profits are just booming. CEO salaries are in the stratosphere. About estimates are that about $50 trillion was transferred in the last 40 years from the lower 90% of the population to the top 1%. People are left hanging, a lot of them in precarious jobs. You don't know if you're going to be called tomorrow or how many hours you're going to have to work. That's Thatcher's live on the market. You idle, ignorant, inferior people, you live on the market. I'll be taken care of along with my rich friends. Well, that's the last 40 years. One aspect is the kind of distrust in institutions, which shows up in things like the anti-vax pathology, and it is a pathology. It's caused huge harm.
Let me, I'm going to ask you one last content question, then I'll wrap us up. Can I ask you about media? Because we've talked a lot about media in public health, particularly around the pandemic lately. So, you know, in manufacturing consent, you, Edward Herman, made the argument for the biases of the media because of the powerful forces behind media, market incentives, access to the powerful, etc. And I'm just wondering, in today's media, is the better approach to create a better media to aim for neutrality, to insist on it, or to accept the reality of these biases and to try to reorient the media towards providing moral clarity on key issues with these biases in mind?
Well, I should say that I remain highly critical of the media today, but the fact is they're better than they were 40 or 50 years ago. There's more open discussion, more freedom. Find columnists expressing opinions that could barely be voiced in the past. The reason for this, I think, is the activism of the 1960s and its aftermath, which did significantly civilize the society. You go back to what was acceptable in the 50s and the 60s, it's almost unimaginable today. And that's affected the kind of people who work in the media. Journalists, a lot of them came out of these experiences, have different attitudes towards things. So it's somewhat improved, but the main factors that Ed Herman and I talked about, they're still operative. And there's been other negative effects. One effect of the internet has been to pretty much destroy local media. You go back 30 or 40 years, local cities had very good media. Boston, for example, where I live, the Boston Globe was a pretty serious newspaper. Actually, the editor and some of the main journalists were personal friends, but they did, for example, the best reporting in the country on Central America in the 80s when that was a huge issue. Los Angeles Times, San Francisco Chronicle, Detroit Free Press, pretty serious journals, a lot of them. They had their own bureaus or various places, independent journalists. They were subject to the same pressures as others, but it was a considerable variety. It's almost disappeared. Take a look at the Boston Globe today. Wire services and local news don't have a news bureau anywhere. And that's had a significant cheapening effect. Means by now, you want to know the news from Washington, there's two sources, the New York Times and the Washington Post. You want to know the news from Karachi, one source, New York Times. There are possible ways around this, but it's a big problem. On the other hand, the internet has it does allow the option of getting a wide variety of sources. You can read independent press, foreign press, and so on. Problem is almost nobody does it. What people do is, young people particularly, is look at Facebook, where they get a shallow filtering of front page news. Then they go to the social media outlets that reinforce their own opinions, which is a kind of a natural tendency. You go to places where you or interact with people you kind of like and agree with. It has a way of separating people from one another, of driving people into uncritical, self-reinforcing cults. It's had a very harmful effect, I think. And although there are positive elements, I mean, it's social media or what are used for organizing for all sorts of positive things. So it's a mixed story, but on the whole, difficult. And my feeling is that the answer to these problems is not to apply band-aids to the symptoms, but to look at the source and see if we can deal with that.
I'm going to ask you two more last questions. So first of all, what advice would you give to young people like our students who are, we get a lot of students coming to our programs who are committed to building a better world. What advice would you give them?
There are lots of opportunities. So in the health area, there's a ton of things that can be done. You go back 50 or 60 years, the AMA was fighting hard to prevent a decent public health system. That's changed. Medical professional, lots of people are pressing hard for it. And that's a crucial thing. It's crucial to develop an actual public health system. I mean, it's shocking when you look at the United States. It takes something as simple as guaranteed maternal care. Every country in the world has it, except the United States, a couple of Pacific islands. It's just scandalous in the richest country in the world, which has enormous advantages. Take the question of preparation for the next pandemic. It's going to take a lot of pressure, political pressure, education, getting people to understand what's at stake, developing the kinds of programs that research and other programs, support programs that'll maybe save us from that next catastrophe. Everywhere you look, there are opportunities. There should be much better pay for nurses, for not just better pay, but better working conditions. All sorts of things can be pressed for. It takes public education, popular organization, talking to your neighbors, groups, activist groups, pressures on government. All of this can be done. So I think there are lots of opportunities for making a better world. That's just in this one area. There's numerous other ones. I don't have to bother telling you that if we don't deal with the crisis of heating the planet, we're all going to be finished pretty soon. That's something that just can't be overlooked.
Thank you. My last question. So what gives you hope for the future?
Two things, three things. One, looking at the past. You look over the past, I can go back to my childhood, but many things since. There were terrible obstacles and barriers. A lot of them have been overcome because people didn't give up. They kept working under harsh conditions, harsher than we face now, just didn't give up. They made improvements. Second reason for hope is that there's lots of people, mainly young people, who are really dedicated and devoted. So take the environment, groups like Sunrise Movement, Extinction Rebellion, others are out there struggling, another reason for hope. But there's a much deeper reason. You only have two choices. You can decide to give up hope and help ensure that the worst will happen, or you can grasp the opportunities that exist, and they do exist, and maybe it'll help make it a better world. That's not much of a choice.
Professor Chomsky, thank you. And thank you for everything you've done over so many decades. Thank you for the inspiration you continue to give us all.
Thank you.
Take good care.